Welcome all. It must be a slow day here. We're having some folks pop in here at the end. So I think I will go ahead and get started. And Rachel, if you want to watch the admit room, do you see it? Mm-hmm. Okay, great. Well, welcome everyone to our first in a series of Navigating Special Needs Family Training. I'm Diane Zauer-Brenneman. I am a family member and I'm the Training Director of Child Health Specialty Clinics, which is located in the Division of Child and Community Health. I wanted to go over just a little bit of Zoom etiquette for people who maybe are new to it. If you could keep your microphone muted unless you're talking, that would be great. Keep your video on if you would, unless you need to do something private, it's fine to shut it off. If you have questions for the speaker as we're going through the training, please use the chat feature, which is at the bottom center of your screen view. And our facilitator will gather questions for the discussion period. Also, when we're together, we like to just kind of go over some guidelines for how to be together. We like to say, share the air. If you are sharing your expertise or asking a question, be brief and succinct so everyone gets an opportunity. We keep confidentiality. The resources that we share today are meant to be shared broadly, but personal stories that you hear are kept in confidence. We invite you to speak from your own experience, not telling another family story, but from your own experience. And we like to only give advice when the person says, "I'd like to have your advice." Okay. There might be some things that come up that are questions and comments outside the goals of this training. And if so, the speakers will say, let's put that in the parking lot and address it at another time. Okay, let's see who's here. When I call your name, I'd like you to unmute yourself, say hello, and tell us where you're from. So, Shelley, would you unmute yourself?
All right. Can you hear me?
Yes.
Great. Hi, everyone. My name is Shelley Johnson, and I live in Ankeny, Iowa.
Thank you. Jody.
Hi, I'm Jody Ballard, and I live in Amana, Iowa.
Great. Megan.
Hi, I'm Megan Vogt-Costner, and I live in Waverly, Iowa.
We're all over. Shannon.
Hi, everyone. I'm Shannon, and I live in Ames.
Okay. Amira.
Hi, my name is Amira, and I live in Cedar Rapids, Iowa.
I have one called Shapiro. Who would that be? Maybe
I'm Jeremy Shapiro. I live in Newton.
Hi, Jeremy. And who did I miss?
I'm Alicia Carwall, and I'm here from Adel. I do have my, I'm not live right now because I'm in the car, so I have my video off, but
That's
hopefully we'll join soon.
You know, when you put your video on in the car, it makes everybody dizzy. So
Yes.
that's kind of you. Am I missing anyone else? Okay, you'll see some other folks pop in. We did have 30 registrants, so we think that either people are still getting their lunch for their kiddos or something came up, which happens in the family world, doesn't it? I'd like to call on the planning committee now and have them introduce themselves. Rachel, would you start?
Hi, I'm Rachel Charlo, and I'm a family navigator and a parent of a child with special needs.
And Martha?
Good afternoon. I'm Martha Hamlin. I'm Program Manager for Family Engagement for Child Health Specialty Clinics. It's good to be with you.
And Jill?
I'm Jill Stevenson, and I am a family advocate and have a child with a special health care need.
Okay, it's been fun to work with these family members to plan this training, and we're excited to offer it to you and to learn from you how it is that you coordinate care for your child. As a form of a little icebreaker, let's do this thumbs up activity. At the bottom of your screen, there's a little thing that says reactions. And if you punch that, you should see a thumbs up. So why don't you go ahead and put a thumbs up in your video so you can see how that works. Sorry for our phone participant. Good. Okay, so let's see. Thumbs up if you have a child under 18. Okay, we have some young ones. Good. And thumbs up if you have children older than 18. I think if you click it, it goes back off if you want to take it over. Okay. Thumbs up if this is your first training for children and youth with special health care needs. Okay. And how about if you've attended other Iowa Family Leadership Training Institute trainings? Okay.
Mom! Hold on.
How about if my child has been diagnosed within the last 3 months? So any early in the diagnosis, okay. If you also have typically developing children. Great. So we have some big families. How about, has it been a challenge to juggle school, work, and home life during this pandemic? I was going to say, if anybody didn't put a thumbs up, I was going to call you after the training to see what you've done, actually, to make that not challenging. How about if you have hobbies? A couple of us have hobbies. How about I used to have hobbies before COVID-19, right? When I could do them. And if you could, just go ahead and type in the chat box one hobby that you enjoy. So we got reading and sewing and knitting, walking and biking. Great. Okay. We hope that that is something that you can do, and thanks for participating in this icebreaker. I think we have a couple people that I didn't call on. If you could unmute yourself and introduce yourself, Emma, where you're from. I'm sorry. Just say where you're from.
I'm from Haywarden, Iowa.
Okay. Great. And Erica? Erica is a staff member, and she's usually doing two things at once. So she may well be signed in here and also on another call. So did I miss anyone else? Thank you, Jill. Okay.
There's Kimberly Von Beek.
Okay.
Okay, and Erica chatted in.
Okay, great. Doesn't have a microphone today. Great. Kimberly, do you want to unmute yourself and say hello?
Yep. Hi, how are you?
Hi. Where are you from?
We're from Inwood, Iowa, which is by Sioux Falls, South Dakota.
Great. It's nice to have you here. Thank you. And who is the one that says Wedgwood?
I think they're still dropping in, Diane.
Okay, very good. We'll continue on then. I did want to say a little bit about who we are and our home within the University of Iowa. We are child health specialty clinics. We're within the Division of Child and Community Health, which is a pediatric division in the Stead Family Department of Pediatrics. The child health specialty clinics are located throughout the state in areas where there are gaps in services. So you'll see in the metropolitan areas we don't have a center because there are plenty of services there, but we might just have a satellite. Our centers have staff that are sometimes the staff will have a registered nurse practitioner and a social worker, but all centers have nurses, family navigators. We have program staff in Iowa City and other regional centers. And in Iowa City, we also have public health professionals on our staff who are thinking about how to better serve children and their families. So what's a family navigator? Family navigators are peer support. We are parents with lived experience of a child with a physical, mental, or emotional diagnosis. We receive training to be family navigators, and you can see the list of the programs that we serve in there. Pediatric Integrated Health Homes, Community Circle of Health, Health and Disease Management, Early Access. Early Access is a statewide service with the AEAs, but we also have service coordinators within CHSC who are family navigators as well. Regional Autism Assistance Program, and there are family navigators that work just in regional centers for general diagnoses too. We all work in teams with the families that we serve to improve healthcare for our children. And if you don't have a family navigator and you'd like to explore that, there's a phone number there on the slide or an email that you can investigate. I'd encourage you not to overlook the importance of peer support. Other family members with lived experience around you who have been there. We also often call it finding your tribe. And so I'd like you to chat in the chat box. What are the groups that you belong to? Who supports you? Where do you find support for the journey of parenting a child with special needs? These could be Facebook groups. There's NAMI. Could be a diagnosis-specific organization like NAMI. Could be your church, your community, school. Just go ahead and type in those. Noonan Syndrome Family Support Group. Could be a listening friend. Could be someone from your church or community. Regional Autism Assistance Program. Parents, local schools, certainly, someone from the school. So you can see there's some good work already being done as we reach out and find those who support us. Great. And we hope that the registrants of this training over the 8 sessions will potentially be a part of your network as well. There is a chat feature that you can chat someone privately. If you do the drop-down arrow, you can find somebody in particular, and as they're talking, if there's a connection you'd like to make with them, please feel free to do it. It's kind of like passing notes in class, you know, and you won't get caught because the rest of us can't see if you're just doing it to one person. I do want to define our acronyms a little bit. As we get started, you know, we often might say our child has special needs or our child has a disability. In the healthcare world, we use this term, children and youth with special healthcare needs. This is a title used by the Maternal Child Health Bureau, which is one of the 6 bureaus of the Human Resources and Services Administration. This is an agency of the United States Department of Health and Human Services, and it has, MCH has a long history of caring for mothers and children in our country, including those with disabilities. So who are children and youth with special health care needs? Well, we know there's over 128,000 of our children and youth either have or are at risk for having a special health care need. Might be a chronic condition, might be behavioral, developmental, ADD, ADHD. It might be a complex medical condition like spina bifida or cerebral palsy that all fits in the category of children and youth with special health care needs. How do I know if I have a child with special health care needs? Well, if your child requires health and related services beyond that which is required by children generally, we include you in our our child and youth with special healthcare needs world. It's nice to know 1 in 5 U.S. families has a child with special healthcare needs. So we're going to turn it over to Martha now, who's going to talk about the essential role families have in taking care or care coordinating for your child. Martha?
Thank you, Diane. And good afternoon, all of you. And congratulations on registering for and attending this training. Like you, I am a parent. I'm also a grandparent of children with special health care needs. So when Diane did her icebreaker, I could say that I have children over 18 and I have children under 18 who have special health care needs. I know how confusing the system is. I would say at the beginning of my journey, I didn't even know that there was a system, and there are times I do wonder, is there a system that's that I can navigate? And, you know, especially I didn't know that there is a system of care where ideally all of the parts are talking with one another and working together. What you see on this slide is a well-functioning system of care, and it's the print is a little bit little, but I'll explain what it is. If a system of care is working well, the priorities of the family, including the child and the parents and anybody else associated with that care, are at the center of all the services. That means that the services don't start with providers and their convenience, and they aren't only about the child. The well-being of the family is at the heart of services in a system of care because family well-being is essential to child well-being. It's important to surround families and children with special health care needs with the support of other families. Diane talked about the importance of peer support that you can get from venues like this. You can receive from family navigators and from family-serving organizations. It's important to have good clinical care, our primary care providers and specialists. It's also important to have care coordinators, which may be a new phenomenon for you. But those are people who work with us to make the connections between medical appointments that we need. Another important part of the system of care are those public health professionals, like those that we employ in our administrative offices, who are thinking about how do we make the system of care better. But they're also asking you, how do we make our services and our system of care better, because we families are on the ground using those services, and we want to tell them this is working, this is not working. The pink ring around the family ring and those critical services has an array of services that support the child and family in every aspect of their lives. So that's faith, that's recreation, that's the neighbor down the street, that's emergency services, that's telehealth, which has become so important during COVID-19, right? Please recognize that so many institutions and organizations and people that we may take for granted are part of our overall well-being and that of our family. So that old saying, it takes a village, is very true, and it's great when the village talks to one another, right? Next slide, please, Diane. So families are, or should be, at the center of services, as we've said. We're also the glue that holds everything together, right? And that's no surprise to any of us. I'm astounded that you're able to be with us at noon on a weekday, and I'm just so grateful that you are, because I remember when my children were little, and that was a major feat to have 10 minutes to myself, much less a whole hour. But especially during this time, when we're worried maybe about support staff coming to our doors, but even in calmer times, we're the ones replacing G-tubes or drilling down insurance denials, right? Or advocating for services, recommending accommodations in our child's IEP, advocating to have our child's IEPs honored, following up on referrals, and coordinating care. And again, that's completing all the tasks that need to happen between those telehealth appointments. We wear a lot of hats. Some days that feels like a balancing act, doesn't it? But most days we manage to do it. I'm sorry, I lost my notes. Okay, we've heard about the assistance that's out there. We know there are case managers and care coordinators. There's service coordinators. There are family navigators. Now you know about those. There's community health workers. We also know that there's such a thing as care plans. We hope that we've been involved in that care planning. We know that there are health homes. Later on in the training, we'll learn more about organizing our care and about care notebooks and about care mapping. Even though all of these entities exist and we may have a vague idea of what they are, I think we've all experienced that feeling of isolation, right? Of not knowing what door to knock on, especially when we're faced with a new diagnosis or a shift in our child's diagnosis. Where do we start? Who can be that first door to knock on for someone who's going to help with our families? I think that's a perennial question. Next slide, please, Diane. On this slide is a list of possibilities. We know it's not going to be complete, but this is a start. In every state, there are services that are generally available for parents of children with special health care needs and those children with special health care needs. For instance, in Iowa, Child Health Specialty Clinics is Iowa's Title V program for children and youth with special health care needs. There is a Title V agency in every state, so if you move to another state, you can access them for services. Iowa's has been seated at the University of Iowa since 1936, when those early planners thought it would be a good idea for parents of children with special health care needs to be able to partner with medical and public health professionals. Likewise, there's a parent training information center in every state to help with educational concerns. In Iowa, that's Ask Resource Center, and many of you are familiar with Ask's wonderful services. In every state, there's also a program for children and youth with special health care needs who are ages 0 to 3. So in many states, that's called early intervention. In Iowa, that's called early access. In most states, there's a Learn the Signs Act Early Ambassador with information about developmental milestones, and we're able to connect you with that person if you're interested in those materials. The rest of these organizations have state-specific resources. So we know, of course, that every state has a Department of Education. In Iowa, there's an entity called Family Educator Partners, and those are family members who serve as liaisons between parents and school districts when parents have questions about educational services. Iowa also has several diagnosis-specific family-run organizations, and we have a list of those that we'll share with you after the training. But we're not giving it to you now because there could be that we're missing some. We're going to rely on your expertise to make that list more complete. Those family organizations were founded by family members like you who wanted to make a difference for their neighborhoods and communities. We've also included 2 databases, the Iowa Family Support Network and Iowa Compass, because if you access those, they are treasure troves of resources. So let's take just a minute now, and in the chat, would you please chat in your Goto Resources? And again, I apologize for people on the phone. But, and you know, if something on this list is a Goto resource for you, feel free to give a nod to it in the chat. Okay, so what are your Goto resources? What doors do you knock on when you don't know what to do next? For me, it was the National Alliance on Mental Illness when my son first became ill. And, you know, I will always be grateful to NAMI for fulfilling that role. How about the rest of you? Diagnosis-specific organizations, a Facebook support group, okay. Diagnosis-specific. And sometimes those diagnosis-specific organizations are national organizations, right? Grantwood AEA. It's always a good resource because they have professionals helping with assessments and next steps in schools. Okay, early access, that would have, before my daughter turned 3. Ask Resource, RAP, AEA. Amy Kula says AEA. Shannon gives a shout out to early access. Yeah, that's a tremendous referral source for children when they're first exhibiting some delays. And Amy Kula says the Autism Society of Iowa. So it's a diagnosis, family-run organizations. They're so important in our system of care. Thanks for participating in that. This is only a beginning. And if you go back just a minute, Diane. In my own journey, I felt as if I turned over rocks one by one as I struggled to figure out how to help my son. When something changed, I always returned to that first door that I knocked on because I found a kind soul associated with a family support organization who also had a son with a special health care diagnosis, and she became my North Star. No matter what happened, and I was stuck, I went back to that first door. We all need to talk to someone who gets it, right? And so that's part of bringing all of you family members together. So just to expand your tribe. Thank you, Diane. Next slide, please. In our journeys, being a good partner matters. I don't know if you've heard of Family Voices. That's the premier national family support organization. There's an Iowa chapter seated at Ask Resource Center. But Family Voices encourages us to partner with our child's providers, and that's educational and healthcare providers, with our health plans. We've got to be able to talk to insurance. Who's paying for this care, right? We want to have some relationship with them. With Title V, because we can open the door to some services. With the programs and agencies in that system of care, and then with other family leaders, because we learn so much from the people in the waiting room and people on Facebook groups and people in our communities. By partnering, healthcare improves. There's some things to think about as we partner, and again, we go back to Family Voices. Next slide, please, Diane. And the Maternal and Child Health Bureau to think about what it means to be a good partner. So these are some elements that were developed by the Maternal and Child Health Bureau. Families and professionals work together in the best interest of the child and family. So we are working alongside. We're not having services given to us or bestowed on us. We are partnering. We're right alongside all of those professionals who work with us. And we have to remember, as the child grows, that child assumes a partnership role too, but they'll best be able to do that if they've seen us do it well. Can you go on, Diane, please? Everyone respects the skills and expertise brought to the relationship. Do we think of ourselves as experts? Certainly, we know our child better than any professional, and it's important for us to articulate what we know about our child that the professional may or may not see, and to be an advocate. We hope that the professional recognizes our expertise, but the more we show up, and we like to call this as our best selves, the more the professional will recognize us as partners. Next bullet, please. Trust is acknowledged as fundamental, and we think about our own relationships and partners. If we don't trust one another, it's hard to continue at that good partnership. So how can we build trust? By doing our best, by showing up as we expect the providers to do. Communication and information sharing are open and objective. So there's communication and information sharing that we expect from our providers. If there's a new diagnosis, there's a change in diagnosis. I've heard stories of parents who have a child in the hospital after birth, and the child will be there for 6 weeks, and the whole clinical staff knows that this child has a genetic diagnosis, but don't tell the parents. That's critical information withheld. At the same time, we own some critical information that we're obliged to give to our providers too. So if we've seen a change in our child's symptoms or in behavior and so forth, we want to be able to exchange that information with the professionals who serve our child. Participants make decisions together. I don't know if you've ever heard nothing about us without us. That came out of the disability movement, but families have adopted it. Don't make a decision without my input. And sometimes we have to gently remind our partners that we need to be partners in that decision-making process. And next bullet, please. There is a willingness to negotiate. With all relationships, there will be differences of opinion, there will be different perspectives, but it's important to keep showing up, knocking on our partner's doors, saying, I'm not sure we're on the same page, let's talk some more about it. So for a partnership to work, both sides must be willing to continue talking and to negotiate. Throughout this series, we're going to learn from one another. So we expect to learn from you too. I just love when parents get together because we learn so much. But we're going to learn how to partner well with all parts of the system of care. If we do that, our family's well-being will improve, and also healthcare, the healthcare system will improve. Thank you for joining us, and we look forward to this new journey with you. Our next speaker, Jill Stevenson, will tell us a little bit about her journey. Jill?
Thank you, Martha. Like Martha said, I'm here to tell you a little bit about my journey of becoming a family advocate. My story starts with the handsome guy as you see pictured, my husband Daniel, my 10-year-old son Will, and my 14-year-old son Wyatt. That extremely good-looking 14-year-old is what brings me to the world of special healthcare needs because he is on the autism spectrum. We live in a town of about 6,000 people in rural southwest Iowa, where 14 years ago, there were very few resources for families. I could tell you about all of the obstacles and struggles that we have went through with Wyatt, but I think everyone here knows those stories because you're living them. Instead, I wanted to tell you about how our journey brought us to some amazing resources, connections, relationships, and how it brought me here today with part of my tribe. The word advocate is defined by Webster's as a person who pleads another's case or who speaks or writes in support of something. I think the word advocate can be intimidating to some. What do you picture when you think of an advocate? For some, there's a picture of someone holding a sign, standing in a state or federal building, chanting. Well, I have to say the only sign that I have held was to wish the school's team good luck at state, but I still have time, and I never say never anymore. I lost my train of thought. In my case, becoming an advocate unknowingly was when Wyatt was about 2 years old. We took him to the family physician because I had concerns that he wasn't talking. He wasn't really saying words. He was just making sounds. And the family physician didn't have any concerns. So I trusted my gut. I did some research and I contacted the area education agency. That was the first in a long line of connections that we have made to help support our family. Wyatt started preschool on his 3rd birthday on a speech IEP where his teacher helped us advocate for what he needed going into kindergarten. And she connected us with the occupational therapist and the school psychologist from the AEA in our area. They became a big part of Wyatt's IEP team. The OT was later added to the autism team, and now she's currently the lead of our autism team. And she has been with us and Wyatt for going on 12 years now. I will not hold an IEP meeting without her there. She knows him in the school setting like we know him at home. Through those relationships, I was also connected to the Family and Educator Partnership, which Martha mentioned, when we needed extra support at one of our IEP meetings. If you don't know about the Family and Educator Partnership, I think that you should look them up. They really are great in supporting families. The year before Wyatt would start middle school, I quit my banking career to become a substitute teacher's associate. I did this specifically to have a firsthand look inside each classroom and I did just that. Now, I'm not telling you to quit your job, but I would suggest volunteering or being part of the parent and teacher organizations or anything in your community that involves getting to know the teachers better to make connections at your child's school. The following year, I was offered a full-time position as a preschool associate. It just happens to be at the preschool Wyatt started out at. I made many, many connections, including special education teachers and administrators, and I became a better advocate for not only Wyatt, but for other children during this time. I also started a 501c3 nonprofit and a support group with the OT, who is now on the autism team. About the same time, we started a support group, and numbers were getting low. Then I got an email from Cheryl, Wyatt's OT, saying, "You should do this," with an attachment for the Iowa Family Leadership Training Institute. IFLTI is a training for families of children and youth with special health care needs to find their own path to leadership. Now, I did not think of myself as a leader, but Cheryl was always pointing me in the right direction for Wyatt, so I applied and became part of the 2018 cohort, where there were 13 family leaders just like you, 3 trainers that you see here with Martha, Rachel, and Diane, and a mentor that became a great friend of mine. Within that experience, I got my spark back. I gained irreplaceable relationships, started a new group to provide sensory-friendly events, and many doors opened, leading to more resources for us. I became a member of the Iowa Regional Autism Assistance Program's advisory panel. I am now a mentor for IFLTI. I'm on the Child Health Specialty Family Advisory Council, and I am now working with Early Access and the specialists that first came into our home when I trusted my gut about Wyatt. I guess you could say things have come full circle for us. Wyatt's journey is not over, but through the connections and tribe that we have built, we are confident that we are on the right track. He just got his driver's permit and is taking driver's education class. He has started to advocate for himself as we begin to prepare him for college and adult living. Every single one of these people and experiences had led me to the knowledge and confidence I have to advocate for my son and all children. If I wouldn't have gotten an email from Cheryl, his OT, to apply for IFLTI, I wouldn't have met Martha, Diane, and Rachel, and I wouldn't be here today. Brene Brown is one of my favorite authors and researchers, and she says, "Grace means that all of your mistakes now serve as a purpose instead of serving shame." That statement couldn't be more true for me. The road of being a parent and caregiver to a child with special health care needs is rough, winding, and uncertain. But you are stronger than you think you are. You will make mistakes, but you don't let those mistakes define you or haunt you. You learn from them and move on. It won't be easy, but you can do this. Thank you. So now I am going to turn it over to Rachel, who will share some information about self-care and give you the objectives for our upcoming session.
Thank you, Jill. What a beautiful story. And so whether you're at the beginning of your journey as a care coordinator or you've been doing this for years, we recognize that it's important to nourish ourselves. And you may have heard of the analogy of the oxygen mask. Put on your oxygen mask first before you take care of others. But I encourage you to think of this analogy in a new way, not in terms of doing it in crisis, but putting on that oxygen mask before it is necessary, before those moments that you are absolutely in desperation. So I think of self-care in terms of nourishing yourself, whatever that might look for you. Self-care is more than just the things that we might do from day to day to pamper ourselves or to take care of ourselves, but growing who we are. And as a care coordinator, it's important to do that. Self-care allows us to be reflective about who we are, what our goals are, who our children are, and help them to become their best selves through becoming our best selves. So thinking about that as the underpinnings of all that we do as we go forward, and continuing to view our self-care in that perspective. So let's look at what's going to, the objectives of the trainings going forward. When we come back together on July 10th, we'll talk about improving those communication skills. We'll discover techniques to partner with our schools, our doctors, whoever it is that's in our life and in our child's life. We'll understand basic guidelines for advocacy and recognize those effective communication skills. When we meet on the 24th, we'll talk about organizing all of that information, keeping good records. What are some of the effective methods of keeping records and organizing all of that? And thinking about a variety of settings that our child's life is in and what information is needed and how to keep that together. On August 7th, we'll talk about exploring care coordination. We'll understand family-centered practices in Iowa's system of care, as we've talked about a little bit today. We'll identify key members of our care team and look at those national standards for effective care coordination that we can use for a model. And then we'll talk about navigating the world of special needs in the school setting. How to partner effectively with our child's school, understand educational provisions in our state and the federal law for children with special needs. And then on September 4th, we'll talk about navigating waivers and those financial resources in the state of Iowa. Identifying benefits such as Medicaid and the waiver services, how we can best utilize them, and how to work with our team members, whatever those financial resources are that we're working with. And then on September 18th, we'll talk about finding reliable resources. It's a wide open world when it comes to resources, and there's more than just Google. How do you find those effective and quality resources? And finding health information that we can use as we care coordinate and making sure that they are high quality. And then on Friday, October 2nd, we'll talk about finding resilience and hope. Understanding the outcomes of self-care, we'll discover some of our strategies to adapt to adversity and move from that emotions to advocacy. And then we'll learn to find the support of others in our journey. Just like Jill talked about, we'll learn to find our tribe and who is that first door that we knock on if we haven't found it yet. So as we wrap things up today, I just would like to hear from you. What are some final thoughts? Maybe something that you learned today that you would like to share with the group? All right. You're welcome to chat it in. So if you are not registered for one of the sessions and you would like to be, please reach out to me in that email that you would have received about a week ago. We will continue to send out the Zoom and meeting information about a week ahead of time. And we will continue to make contact with you that way. All right. This is who we are. And we want you to know that we are here for you if you have any questions or concerns. And we thank you so much for coming. Like we mentioned at the beginning, it is a gift to be able to set this time aside. And we recognize that for some that may be a struggle, but we thank you for joining us anyways. Diane, anything that I'm missing?
I just did put in a PDF of these slides in the chat. You can download it there if you wanted to remember some of those lists that Martha gave you. And then there's another thing called the Family Organizations in Iowa with some contact information there as well. If you are a foster family and you need a certificate for foster family credits, please chat your name in and we'll make sure we get that there. Can anybody quickly put in the link for Iowa Compass or the link for the Iowa Family Services Network page? I think that would be good to.
And I think there's a chat from Amira.
She says, all special children's parents are great. That is true. So I got Iowa Compass, Martha, if you want to get the other one. So, pardon?
How can we download those?
Does it work to click on it in the chat?
I was just looking at it right now, and okay, I clicked on download. It didn't work. Do I save it, or that's how I?
Try that, yeah.
Oh, yeah. You don't have permission to save this location.
Okay. Did anybody else have luck saving it? It might be a setting on your, Emma, you could get it?
Yeah, I just had to, it said click to, what did it say? Click to download, and then I had to click to open, and it opened in like a clipboard or whatever.
Okay.
Mine says you don't have permission to save this location too.
Okay, so I will put both of those on an email to the group after. I do think it depends on your settings and maybe even your Zoom settings, whether you can get files through the Zoom chat. Any other closing questions? We did put two places there in the chat that are great resources to check and find resources around your community. Iowa Compass and Iowa Family Support Network.